Welcome to Houston Baptist University's Psych 4326, The Psychology of Death and Dying. These presentations are only intended to highlight some important or difficult points from the chapter. They are in no way comprehensive and do not include all the material students will be held responsible for on your exams. You are expected to completely and thoroughly engage with all of the required learning materials. Exams in this course may include questions taken from not just the textbook reading, but videos and PowerPoint presentations as well. This presentation covers some important topics from Chapter 8 in our textbook. Make sure you read all the chapter and take notes. There is much more material in the chapter than we are covering in this presentation. It is important to recognize and respond to the needs of persons who are coping with dying. Research in the 70s found three main needs of persons who are coping with dying. Caregivers don't always realize or acknowledge the level of pain or distress that the dying individual is experiencing. Caregivers don't always have effective resources to respond to the needs of those who are dying. And individuals who are dying are often worried that their wishes might be ignored. Once caregivers realized that they weren't effectively meeting the needs of the persons who were coping with dying, the hospice movement began. Some of the important philosophical beliefs and principles of hospice include: hospice is a philosophy with a primary focus on end-of-life care. The hospice philosophy affirms life, not death. The hospice philosophy strives to maximize present quality in living. This philosophy offers care to the patient and family unit, not just the individual dealing with dying, seeking to provide a sense of securing and support in a caring environment. Hospice is holistic care. It assists dying individuals in working with physical, psychological, social, and spiritual tasks. Hospice offers continuing care and ongoing support to family members coping with dying, death, and loss, both before and after the death of someone they love. There are more important points to the principles of hospice than listed in your textbook. Make sure you understand what hospice is all about. Palliative care and hospice care. What's the difference? To palliate means to alleviate the symptoms of a disease without curing it. So, treating the symptoms of the common cold is a kind of palliative care because there's no cure for the common cold. So we just take the medications that deal with our symptoms: cough, runny nose, fever, etc. In this visual, we can see the overlap between the two. There are 4 institutions that currently care for most persons who are coping with dying. Hospitals provide acute care. Approximately 37% of all deaths in America occur in hospitals or were brought to these institutions for confirmation or certification of death. Long-term care facilities or nursing homes offer chronic care. They provide custodial, nursing, and rehabilitative care for individuals with chronic illnesses or a disabling condition. Around 20% of all deaths occur in long-term care facilities. Home health care programs deliver home care chiefly in the form of skilled nursing and ancillary care. This care is provided to many different kinds of clients. Hospice programs offer end-of-life care for dying persons and their families. They provide a multidisciplinary team. Usually this takes place in the home, but may also be delivered in a hospital, long-term care facility, a hospice inpatient unit, or via a hospice daycare program. Hospice programs currently care for roughly 46% of all people who die in our society. Make sure you read Chapter 8 thoroughly and understand the terms above. There's so much more than we are covering in this presentation. See you in Chapter 9.